Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Today, we're going to have a fun episode. We're talking about debunking GYN myths with Dr. Kelly Culwell, who likes to call herself Dr. Lady Doctor, and we'll get into how she came up with that name. But as most of you know, on my website, we have a whole section called Debunking the Myths about Women's Health. So it's one of my favorite topics to address because we have so many prevailing women's health myths. Now, Dr. Kelly Culwell is a fellowship-trained OBGYN who is passionate about women's healthcare, so she and I have a lot in common. She's here with me today to dispel any shame, myths, misperceptions, or misconceptions women have about their bodies, and you know we have lots of those. She received her medical degree at University of California, Davis, did her residency at UC San Diego, and her fellowship in family planning, along with her master's in public health at Northwestern University. She's currently based in San Diego, and I wish I knew that when we set up the interview, or I would have asked to do it in person. I am in frigid New Jersey. Dr. Culwell has 17 years of experience in women's reproductive health. She has worked with a wide variety of organizations, including as a medical officer for the World Health Organization in Geneva, Switzerland, as a senior medical advisor to the International Planned Parenthood Federation in London. And currently, she's the chief medical officer of Evofem Biosciences, a company committed to improving the health of women throughout the world. And we're going to talk to her a little bit more about that as well. Welcome, Dr. Lady Doctor. You are in the ladies' room. And how did you get that moniker?
Well, you know, it's funny. I'm sure you have had this very similar experience where when you're going into and doing your hospital rounds and you're seeing patients, you may run across a woman or a family member that asks, nurse, could you give me some ice? And, you know, when you have to politely say, oh, you know, I'm happy to get you the ice, but I am your doctor. And they say, oh, you're a lady doctor? And so I decided to take that and do a little play on it and in fact, that I am in fact Dr. Lady Doctor.
You could have done, I'm a lady parts doctor.
Exactly. That was the other option.
But when I saw that you had listed this as, you know, your nickname, I was reminded of when I was in residency, we had a married couple who were both physicians. And so this was a woman who was at an age where most women were not doctors at her age, but their last name was actually Doctor. So their names were Dr. Doctor and Dr. Doctor. So the nurses and the residents used to call them Mrs. Dr. Doctor and Mr. Dr. Doctor.
Nice. I had a college professor who was named Dr. Doctor, but she had a PhD.
Right. So tell me, what is aside from this interview, what's your most interesting, unique, or different experience you ever had in the ladies' room?
You know, that's a really good question. And I would have to say it was recently we filmed a web series for Dr. Lady Doctor, which is going to be out soon. We actually had a soft launch of the web series at Blog Her back in New York in August. And this web series was about, again, sort of dispelling some of the common myths and misperceptions in women's health. And we actually filmed an entire episode in a ladies' room in the basement of an old theater in Los Angeles. And I spent the whole day standing on top of toilets and you know, they tried to get the camera at the right angle and they were standing on top of toilets. And so that was probably my most interesting day in the ladies' room. So hopefully when that video comes out, everyone will see exactly what I'm talking about.
That is hysterical. Actually, when I started this podcast, my original, and I do it from home, my original idea was to actually record it from an actual restroom in my house. And I have several to choose from. And I thought it would be perfect as far as acoustics, and it would be a small room. The problem is there's too much echo. in the actual
Yep.
restrooms because of tile and things like that. And I'm actually
Yeah, we definitely, yeah.
much more comfortable in my office with my big comfy chair rather than actually sitting on a toilet. That just like
Yeah.
didn't work.
We gave the sound guy quite a chore to get the sound at all consistent when we were all in different places in the bathroom. So yeah,
That's
I
funny.
get that.
Actually, I could even ask women when I ask this question, I could say, what's the most unique thing you've ever done while sitting on a toilet? Certainly every woman who's ever had a child has had multiple experiences where we've had to use the toilet while one or more children were actually sitting on our laps or,
Yep.
positioned in different places so we could see them in a public restroom. But we won't
Right.
go there. Tell me, what is Evofem?
So Evofem is a biopharmaceutical company that is in the clinical stages of producing a contraceptive vaginal gel, and that gel is called Amphora. And Amphora is just finished our phase 3 contraceptive trial, and we're going to be submitting for approval to the FDA. We're hopeful that it will be a product that will be available on the market as early as 2020. We're also studying the same product for the prevention of chlamydia, because the product itself is an acid buffering gel, and it just keeps the pH of the vagina in the sort of normal acidic range, even in the presence of semen, which can help to eliminate the ability for sperm to survive, but also other sort of microbes. So it's an exciting time here, and I'm hopeful that we'll have a new product to add to the contraceptive panel soon.
Awesome. And that sounds very exciting to have a vaginal gel, which would prevent chlamydia. The problem is you'd still have to use condoms to prevent all the other STDs. So maybe we start there in terms of debunking the myths. You and I have heard so many myths and misconceptions and misperceptions about women's health. What's your favorite STD myth that you love to debunk?
Well, one that it comes up a lot is around STD testing. And so a lot of times when women come in and they want to, test me for everything, doc, they literally think that they're being tested for every single STD possible. And I try to, educate women that there are certain STDs that we don't test for routinely in women that don't have symptoms. So, those might include herpes, it might be HPV, which we really only check when we're doing pap tests. But really, I think the most important thing is when you ask your doctor to test you for STDs, you know what you're actually being tested for, so that you know what potentially you've tested negative for.
Right. Women could have an HPV test ostensibly anytime they want. We just recommend it only for women over 30 because HPV is so common in women in their 20s that probably 80% of women in their 20s would test positive. The challenge, I think, with HPV is that we don't really have a test that's ready for prime time in men. So many times when I hear women wanting to get tested for everything, it's when there's a new partner, right? So the new thing is you show me your test results and I'll show you mine. But those are only accurate insofar as what we could clinically test for as of that day. So the other myth that I hear very frequently about HPV is in women over 50, or STDs in general, not just HPV, in women over 50 who are re-entering the dating pool. They think they don't need to use condoms or practice safe sex because they're quote unquote, too old, or they're not thinking about contraception. So they're certainly not thinking about STDs. And what we've seen is this, bimodal distribution of a peak of HPV in the 30s and then another one in the 50s.
Yeah, absolutely. Mm-hmm.
So speaking of aging, I wish I had $1 for every woman who told me this: I'm not old enough to get pregnant. Or I'm too old to get pregnant.
Too old to get pregnant, exactly.
Yeah. So who is old enough? Who is old enough or not too old to get pregnant?
Well, so, women, the thing is that's really important about being able to get pregnant is you can get pregnant before your first period. And the reason for that is because your first period is going to be preceded oftentimes by an ovulation. So by, putting an egg out. The same thing that happens in the postpartum period. A lot of women who don't realize that they're at risk for pregnancy because they haven't had a period yet after they gave birth. But in fact, that first period is going to be preceded by an ovulation about 2 weeks before that period. So you can definitely get pregnant, before that first period in terms of who's too young. But you have to be ovulating. You have to, put an egg out in order to get pregnant. But once you do that, there is no age that's too young.
Yeah, I think that's probably the number one thing that they teach incorrectly in ninth grade or eighth grade health class. And that is, I often hear from women this message that you ovulate 2 weeks after you have your period. And in a woman, of course, with a 28-day cycle, exactly, yes, that's correct. But the really correct answer is you ovulate 2 weeks before your period.
Exactly.
And we don't always know when that's going to be. Because
and that's what's challenging. Yeah, that's what's challenging about tracking is that, you can't, it's easier to look backwards than it is to look forward to predict your ovulation.
Right. And so when we're looking to prevent pregnancy, we also teach women, if you look at a guy, you can get pregnant.
Right.
Or at my daughter's camp, they used to actually tell them, if you go into the boys' bunk, you could get pregnant. But when you're trying to conceive, many women find it's not actually that easy. What advice do you give to women who are trying to increase their fertility or trying to increase their chances of getting pregnant?
Right. Well, speaking to that very point, one of the number one things when people come to me concerned about fertility, the first question I ask is, are you having sex? And how often are you having sex? Because you'd be surprised how many times women are like, well, I've been trying to get pregnant for a year, but my husband travels a lot, and so we have sex maybe once or twice a month. And so, but again, because of this sort of history of being told, well, you can get pregnant on the first time, every time you have sex, you can get pregnant. That is true, but more likely than not, you won't get pregnant each time you have sex.
So that's why I'm a big fan of ovulation kits and ovulation monitors for people who are trying to conceive. But there are lots of myths about, all of this. So let's take a couple of them. My favorite one is, this myth that you can only get pregnant within the 24 hours after ovulation.
Right.
Go.
Right. Yeah. So obviously, sperm have this amazing ability to survive and can get into the reproductive tract and can really survive for a longer period than that. And so, you have a longer window than just that 24 hours after ovulation. Definitely.
And so the window is actually about 6 days, depending on everything, 5 or 6, give or take. And ideally, for somebody who is tracking their ovulation, ideally they want to have sex just before ovulation.
Right, exactly.
So one of the other myths I very frequently hear for women who are on the pill, who are coming off the pill, there's this myth that you have to, quote unquote, wait for a certain amount of time before you can start trying to get pregnant when you come off the pill.
Right. Or that you can't get pregnant for a certain time. So women will sometimes stop their pill 3 to 5 to 6 months before they want to get pregnant, thinking that they won't be able to get pregnant right after stopping the pill. And in fact, you can get pregnant that very next month. And so that's something that I see, I try to encourage women, if you're going to stop the pill, you need to that it would be okay if you got pregnant right then. And you don't need to wait a period of time. You don't need a washout of the hormones. The hormones are going to be gone from your body very quickly. That's definitely a myth that I hear a lot.
I think in the old days, and by the old days, I mean when I first became a doctor, I think we used to tell women to wait till they got their first normal period for 2 reasons.
Right.
Number one was because in those days, we didn't really have a great way of deciding how far along you were, except for the first day of your last period. And so we didn't want women getting pregnant before they had that period. But the other reason was, what's the biggest surprise that can happen when you get pregnant immediately after going off the pill?
well, that you don't know about it.
Well, the biggest surprise for some people is, multiple pregnancies is twins.
Oh, sure. Yeah.
So
Right.
you can have multiple ovulations the first time. I don't know how common that is. But it was common enough that we, used to give that advice. Now with IUDs, on the other hand, lots of myths about IUDs. I think the biggest one that I hear for women who say they don't want to be on an IUD, they say it's because I don't want, I may want to get pregnant before 10 years.
Right.
And so I always say, well, for an IUD, the contraception lasts 10 minutes or 10 years or anything in between. But for an IUD, of course, you can get pregnant, what I always say is you can get pregnant immediately after taking it out, but please wait till you get home from the office before you.
Exactly. Yeah.
Now I
yeah.
understand you had an IUD before you got pregnant.
I did. So I'm actually on my third IUD, but I had an IUD before I got pregnant, which also that's a controversy. There are a lot of, in the old way of practicing, we didn't insert IUDs in women who had never had babies before. And now it's pretty common that we do.
Well, and the American College of OBGYN has issued a statement that IUDs are a perfectly good choice for young women who've never had children now, to try to dispel that myth. But that's a very common myth that you can't.
It is very common. It's common, and it's common with some healthcare providers too, unfortunately. But yeah, so I had my IUD and I was able to, it was terrific because I was able to wait until I was ready. But I did not have it in. So I had the levonorgestrel IUD that at that time was approved for 5 years. And I was able to, have it removed after 3. And then I actually struggled a bit because I didn't have a period for a while. But this is a good example of being able to be pregnant without having a period. I actually got pregnant before I ended up having my period once my IUD was removed. But it was a very difficult, weird time to try to figure out, when am I ovulating? I'm never bleeding. I don't know what's happening. But yeah, so I was able to time it, and then after I gave birth, I had another IUD put in and used that one for its full period of time, and then I got a third one replaced.
Yeah, I think a lot of women physicians have irregular periods because I think one of the number one causes of irregular menses is stress. Right. And certainly not sleeping and not having a regular 24-hour schedule. I actually didn't get a period between my first and second child. So, when I went in for my first OB checkup and they said, when was your last period? And I wrote, like 2 years ago. They're like, okay, Don't be a wise guy. And I'm like, no, seriously. So how does that work? That works because in general, you don't get a period when you're nursing. And when I stopped nursing, I must have gotten pregnant 5 minutes later and ovulated before getting the period, the same way, we talked about. And I knew that was a possibility and I knew that could happen. And I just said, okay, but the odds of that happening are really, really small.
Exactly. But there's always someone. Yeah.
People plan, God laughs.
Right.
But my 2 kids are really close in age and they're really close, which is really good.
Well, that's nice. Yeah. I just have the one because, I think if I had them close, it would have maybe been a little bit easier to take that leap. But once he got out of diapers, my husband said, yeah, that's enough.
As if it was any work for him.
Right.
So what's your favorite myth that you hear about pregnancy and fertility and contraception?
Yeah, I think that, a really common myth is that, and this isn't necessarily related to pregnancy or contraception, but it's sort of related to our shame about our bodies and about particularly our vaginas. Women really thinking that they need to do something to keep their vagina clean, that they either need to use all these variety of different feminine washes or, worst case scenario douches, which can really obviously mess up the whole balance of the beneficial and harmful bacteria in the vaginas, lead to a lot of vaginal infections and even put you at increased risk for sexually transmitted infections. So, I hear that a lot, kind of all of this consumer attention around trying to keep your vagina smelling a certain way or looking a certain way it's really more harmful than, obviously than beneficial.
Right. And there's no need for your vagina to smell like a flower garden.
No.
And women will always say to me, well, what if you have an odor? So you want to address that question?
Right. So there, and this comes also with discharge, right? So a lot of women don't realize that some amount of vaginal discharge is completely normal, and that the discharge can change and definitely will change throughout your menstrual cycle, throughout the period, and from different menstrual cycles to different menstrual cycles. The odor similarly can vary throughout the menstrual cycle in different parts. And the only time I tell women to get concerned about their vaginal discharge is if it's different, if it's something that's different than what it has been normally. So if it changes in color, if it changes in consistency, if you develop a really foul smelling odor, or if it's associated with any other symptoms like itching, irritation, or pain, those are things that you need to be concerned about. But the sort of day-to-day changes in your sort of vaginal odor or vaginal discharge can definitely be within the realm of normal.
So one of the very common questions I get, when I go off on this tangent, I think every gynecologist kind of rants about this all the time. I think one of the most common questions I then get is, so how do you clean your vagina?
Just warm water. Warm water on the outside. Just if you need to use it, some sort of very mild unscented soap. But you don't need to put anything inside the vagina. The vagina itself is what we call self-cleaning. So it's the vaginal discharge. One of the purposes of it is to sort of flush things out of your vagina and to keep your vagina healthy. And so that's all I recommend is just plain warm water and maybe a little bit of very mild soap.
I think part of the confusion for a lot of women, and this is one of my pet peeves, is that women use the word vagina. Now that we're empowered to say the word vagina, women use the word vagina to refer to everything that's covered by a bikini in the front.
That's not correct. Big pet peeves too. Right. Yeah. If someone says, when you're not wearing underwear and you spread your legs, I can see your vagina, I say, really? Do you have a speculum? Are you looking inside? Because probably unless you're incredibly close, you're not going to see.
And you'd have to be at the right angle.
Yeah, exactly. It's the inside part. No, absolutely. That's one of my number one pet peeves as well.
I think it's great that women now know the word vagina. And now it's our responsibility to teach them the word vulva.
Absolutely.
So for everybody who's listening, the vulva is the outside part. And, for moms who are getting all hysterical that we're using these words and you're listening to the podcast in the car and your kids are in the back, first of all, they're on their phones and they're not listening. But second of all, I think it's really incumbent upon parents to start using correct anatomical names for their body parts and their genitals when the kids are really little.
Absolutely.
So that they know.
It's funny when I try to encourage the use of the word vulva, I get such pushback. Not because it's nasty or dirty, but that word's ridiculous. Like nobody says vulva. That's just vagina is empowering, but vulva sounds like what is that? And like I don't understand why vagina is a more tolerable or acceptable word than vulva. It doesn't make any sense to me. But I
think people just like saying it. I actually got interviewed by a reporter. I've told this story a couple of times on this podcast. And the reporter did a great job. And the topic was about proper shaving. So for women who want to shave their pubic hair, is it better to shave or wax? And is it okay to wax during pregnancy? And all kinds of shaving and waxing questions. And we went through all of these questions. Not that there's a great deal of scientific literature on this, mind you.
Right.
But we went through all the questions. She wrote an excellent article. There was nothing incorrect except the headline. The headline was, is it okay to shave your vagina while you're pregnant or during pregnancy? And I called them up immediately and I said, you have to change this headline. You can't shave your vagina ever. First of all, there's no hair in there. Second of all, it would be horrible.
I can't imagine. I wouldn't ever want to
get in there. And they said, we know it's incorrect, but that's the term that women use for the lady parts. And that's what we're going with. So of course I've been ranting and raving about it ever since. And I wrote a big, blog post and, did a whole Facebook Live video about it. And I'm just still annoyed. So yeah, I never forget anything. Or as my daughter once said, yeah, my mom doesn't believe in forgiveness. That's not in our book. That's in the sequel.
Nice.
I thought that was great. Okay, so let's switch gears a little bit and talk about myths about incontinence. So this is another common one I hear a lot. First of all, people think incontinence or the involuntary loss of urine for any reason is a problem that just affects people under 5 years old or over 75 years old. And I think the number one myth that I hear, at least, about incontinence is it's just a natural consequence of aging and it's not a big deal and there's nothing to do about it.
Right.
What do you say?
I don't know if this is exactly a myth, but I think the number one thing I hear is that women are ashamed to even bring it up. They don't, it's just so, because we don't talk about it at all, I think people think they're the only one. So even though it might be a normal consequence of aging, they think they're the only ones that has it because no one talks about it at all. And so they're not bringing it up to their friends. They're not bringing it up to their healthcare providers who might actually be able to help them. And unfortunately, as healthcare providers, we don't do a great job of asking the question regularly either. But I think that sort of myth probably stems around the fact that I must be the only one that this is happening to because no one else is talking about it.
Right, because you didn't notice the other 30 women running out halfway through aerobics class. So incontinence is extremely common. It is naturally associated with aging, but so is heart disease. And we never say don't treat heart disease because it's just a natural consequence of aging.
Right.
There are many other risk factors, though, other than aging. And a third of women over 35 have some form of incontinence. And of course, women need to know there's not just one garden variety type of incontinence.
Right, exactly. And the other thing that that women often will think is that that childbirth is the only thing that causes incontinence. And in fact, aging is the biggest risk factor for incontinence. And even women who have never been pregnant or who have, say, been pregnant but only had C-sections, they still are, may develop incontinence.
Although I'm very thankful for my C-sections, I have to say. So it's not just aging that's the risk factor, and it's not just vaginal tract, it's gravity.
Right, exactly.
Not your friend.
Right, exactly.
Whether we're talking about wrinkles on your face or aging of the vagina, back to the vagina, or whether we're talking about involuntary loss of urine. So what should women do who have any kind of incontinence?
Well, so first of all, I definitely think you should talk to your healthcare provider. But before you make that appointment to talk with your healthcare provider, definitely keep track of your symptoms. That's kind of a number one thing that I tell women who have any symptoms at all is try to keep track of your symptoms. When do these symptoms happen? How often does it happen? Is there anything that makes the symptoms worse? Is there anything that makes them better? When did they start? Has it been getting worse? Has it been getting better? Really, all of those factors are really critical pieces for your healthcare provider to know kind of what type of incontinence that they're dealing with. Because like you said, there's not just one type of urinary incontinence. We have different types. We have stress incontinence, which is when you cough, laugh, or sneeze, or jump up and down in aerobics class. Running, even getting up from a seated position sometimes can cause incontinence. Or there's the urge incontinence, which is I really, really have to go. I really, really have to go, and I can't hold it.
Right. So now people are calling that overactive bladder. So that's the commercial. Gotta go.
Right. So, or there can be a mixture of the two.
Exactly.
And the treatments are very different for those two major types of incontinence. So it's important to provide as much information as you can to your healthcare provider. And the best way to get that the most of that 10 or 15 minutes that you have with your healthcare provider is to bring that information with you and not be trying to remember it as you're, sitting, in front of the doctor and being asked all the questions.
And intimidated. I think the other myth that's very common about incontinence is that, well, there's nothing I can do about it anyway, other than adult diapers. And so why bother, or surgery. So people think it's one extreme or the other. So they don't realize that we have a whole range of treatment options. I actually have heard from women who have devised their own treatment where they use tampons or double tampons and insert double tampons in their vagina, thinking of the absorbency, not realizing where the urine is actually coming from, but it's very clever because it changes the angle of the urethra.
They're making their own little pessary.
They're making their own sling.
Right.
Their own lift. So that's actually very clever, although very inconvenient. So let's switch gears then to talk about myths about tampons. So my favorite myth about tampons is that virgins can't use tampons.
Oh, right. Sure.
Is ridiculous. But I think here another very common series of myths. A lot of this is circulating like as an email that's going around, and there are various variations about toxic substances in tampons, and you have to use all natural, all cotton tampons. What do you say about that?
Yeah, I've actually, I was interviewed for an article about this very topic, and but basically what I said was, the FDA regulates tampons. They're actually a regulated medical device. So there is a regulation system about tampons. And so the concerns about high levels of toxic materials, or that these materials are making you bleed heavier or anything like that, are really unfounded. However, if you're somebody who is really into organic living and you really care a lot about maybe the farmers and the field workers who are growing the cotton, and what they're exposed to during the agriculture process, and that this is part of your whole lifestyle, and you can afford organic tampons, great. But from a health perspective, I don't think there's anything there really.
Okay, so from a cost perspective, if you're somebody who really cares about sustainability and things that are organic, and you don't want to spend the money for organic tampons, of course, the other option is a menstrual cup.
The menstrual cup, absolutely. Mm-hmm.
So I think menstrual cups haven't really gotten a lot of popularity yet, or a lot of visibility. Most women I talk to don't know what they are, don't know how to get them. Do you want to talk about that?
Yeah, so they're available. You can buy them on Amazon. You can buy them at pretty much any. You can. That's true. You can buy them at on any most any drugstore. In fact, so my company used to sell a menstrual cup, but a different company has now purchased it. But there's a whole variety of different brands, and they have different benefits. Some of them are usable, some of them actually are disposable. But they can be used for longer periods of time, which is why there's an advantage potentially over tampons. Some of them have little things that come down into the vagina that help you to pull it out. But then on the other hand, those aren't great for using if you're trying to use it to have sort of less messy sex during your period. So the ones that are just simple discs are much better for that. So there's a whole different variety, but you can get them, really any drugstore, or definitely, online.
So a recent myth I heard about menstrual cups is that they shouldn't be used for women who have IUDs, because the suction of the cup can pull out the IUD. Is that true?
Right. That's not true. It was a theoretical risk, but in fact, all the data that has been published on that, there have actually been a couple of reviews published on that, have not found an increased risk in IUD expulsion or anything, or accidental removal of the IUD, anything like that.
I think we hear a lot of anecdotal stories, anecdotal reports, and what women need to understand is an anecdotal report is when it happens to one or two people, but they tell everybody.
Yes, right.
So I think one of the reasons, of course, there are IUDs that come out.
Sure.
Most of the time, they come out and you don't know it, and they get lost. If you have a menstrual cup in and it comes out, it's caught in the cup and you see it.
Exactly. Yep.
I think there also may have been situations where when a woman was taking out the menstrual cup, which you have to do by kind of looping your finger in and pulling it down, they may have caught the string of the IUD and pulled it either all the way out or partially out. And then there are also factors during IUD insertion that may increase the risk of expulsion. So one of the things that may increase the risk of expulsion is if you have it put in immediately postpartum and not at the right exact time, or not in the right exact way, or after an abortion, or after a miscarriage. I always have to remind myself, that when doctors say abortion, we mean abortion or miscarriage. For, in medicine, it's the same word, but for people, for everybody else, it's not the same word. So I think that's a really interesting story. I think one thing I would recommend to everybody who's listening, who's curious about menstrual cups, is to practice putting it in and taking it out when you don't have your period.
Absolutely. Yes. Yes.
Sort of like using a diaphragm, practice it when you don't need it. And there's some great videos on YouTube
There are.
that I was
Yes.
very impressed by about how to put it in and how to take it out.
Well, and women who use menstrual cups are really, it's almost like a cult-like following. I mean, they are really passionate about menstrual cups.
Well, they're so happy about it because they are
yes.
saving a lot of money. They are doing a great deal for the environment.
Right.
And it's
not for everybody, but for women who use them and like them and love, I mean, they are incredibly popular. Yeah. So it's definitely something to give a try if you're interested.
Well, and you don't hear the stories about, all those embarrassing stories. We all have one. I'm sure you have at least one. I have at least one where you had a tampon accident. Yeah.
Right.
Especially when you're going through perimenopause. Now, that's a great segue to great myths about perimenopause. I think one of the most common myths about perimenopause is that your periods get lighter and lighter and further apart until they eventually stop. What actually happens?
Anything can happen. So the average age of menopause is 52, and the sort of perimenopausal period can be 10 years or more up to that point. And it can be anything from your periods get farther apart or lighter, they can get heavier, they can get more frequent, they can go back and forth between all of those things. They can stay completely the same until the day that you just no longer have them. The same things go for what we consider sort of menopausal symptoms, which really are sort of the perimenopausal symptoms that can start with the hot flashes, the night sweats, the mood swings, the vaginal dryness, all of those, the difficulty sleeping, those kind of things can come and go and can start appearing 10 or more years before you actually are officially diagnosed with menopause. And of course, the official diagnosis of menopause is also a challenge because it technically is when you have not had a period for a year. So again, you're looking backwards to make that diagnosis rather than being able to look forward and definitively be able to say, okay, you're done having periods.
So there's another myth. Is there a blood test for menopause?
Not a good single one, no. We can do some interesting things that are, so we can test an FSH level, which is basically, kind of a little bit testing your body's ovulation capacity. We can test that level, but the problem is that FSH level can vary quite widely during the cycle, especially in the perimenopausal period.
So FSH is a hormone released by the brain, which normally tells your ovaries to very simplistically, it's involved with triggering ovulation.
Exactly. And a very high level can indicate perhaps that you're not ovulating anymore. However, those levels can vary widely and kind of come and go during the perimenopausal period. So one single FSH test usually doesn't diagnose menopause.
Right. So just this, it's a clinical diagnosis. And the significance of perimenopause is, as you said, it can be up to 10 years, but it can mean that you're starting to have one or more menopausal symptoms, but you're also having periods. So you're kind of getting...
And you can get pregnant.
And exactly, that's where I was going. So, this issue, we got a little off track earlier about my doctor says I'm too old to get pregnant.
Right.
Address that myth.
Right. So that is, yes, that's a big myth. As long as you are having periods, you can definitely still get pregnant. And in fact, even if you're not having periods, you can get pregnant just for the same reason that we were talking about before, which is that if you skip a couple periods in a row, but then you ovulate, you won't know that you're going to have that period from that ovulation until 2 weeks later. So we really, until you have gone a full year without having periods, we have a hard time feeling very confident that you don't have the ability to get pregnant. And so people ask me a lot, can I stop taking my birth control pill now? Or can I get my IUD out? And in general, we just leave them in, as long as, that they're good. And, we may consider somewhere around the age of 55, transitioning you off and going from there. But for the most part, we have a hard time being able to definitively predict when you cannot get pregnant anymore because of that sort of those fluctuating hormones.
And I think that's another great use for the IUD, by the way, is
Absolutely.
for the woman in her 40s who's decided she doesn't want any more children, rather than having her tubes tied. Ideally, we want his tubes to get tied, but that's a whole nother segment.
Yes.
Rather than having her tubes tied, she could get an IUD and just leave it in for the full length of the term. And then we could talk about if she needs something else when 10 years is up and it needs to come out.
Absolutely. Right.
So address the issue of hormonal IUDs versus non-hormonal IUDs, because another myth is that, you know, when we talk about the IUD, most women think we're talking about one thing.
Right.
But there's actually a whole category of choices.
Exactly. There's two major types, and you just pointed them out. The non-hormonal, which is in the U.S., the only non-hormonal IUD is a copper-containing IUD that basically secretes copper ions. And then the other is a hormonal IUD, which is levonorgestrel, which is the progesterone component of birth control pills, of some birth control pills. So you've got those two major categories. The copper IUD does not affect your menstrual cycle, does not affect the frequency or your ovulations, anything like that. You continue to ovulate, but it can, especially in the early part of its use, increase the heaviness of your flow. And sometimes in some women who are particularly sensitive can increase the cramping that they have with menstrual periods, particularly in the early part of it. But for women who don't want any kind of hormones, don't want any impact on the frequency of their periods, the copper IUD could be a good choice. And then the hormonal IUDs, actually one of the ways they work, they both thicken the cervical mucus to keep the sperm from being able to get through, but they also thin the lining of the uterus. And by thinning the inside lining of the uterus, that decreases menstrual flow. So for women who have a problem with heavy periods, a hormonal IUD could be a nice choice because it could also decrease the flow of the menstrual periods. But it often will make the menstrual periods irregular. And in some women who use the hormonal IUD, they won't have any periods at all after a period of time of use.
And I think one of the things, one of the big questions, obviously the IUD provides great contraceptive protection. However, for many women, they want to know every month that they're having a period, meaning that they're not pregnant. With the hormonal IUD, they're not really getting that reassurance that it's still there. So we used to tell women to do string checks to make sure it's still there. We don't really say that anymore. I always like women to know that they know how to do it if they want to check it.
Right.
But
some women just can't feel it. I mean, some women just anatomically can't quite get there or can't quite figure it out. And so, sort of releasing them from that pressure of having to do those regular string checks, since we know, for the most part, it's not going anywhere. And so, we don't, but it is true that there's not a great way for women to have that reassurance on a monthly basis when they're using, some of these hormonal methods that impact the frequency or stop the periods altogether.
So let's segue then to myths about PMS or premenstrual syndrome. So how is PMS affected by an IUD versus the pill?
So in general, an IUD, the hormonal IUDs, do not provide much systemic levels of hormones, and they don't typically impact your ovulation or your kind of the hormonal fluctuations that you have during your normal menstrual cycle, as opposed to the birth control pill, which essentially shuts down your hormonal fluctuations of your body. And in some women, that can be helpful for PMS or for any kind of premenstrual mood changes, anything like that. To have more of a constant level of hormones can be beneficial, as opposed to that sort of rising peaks and valleys that you get in your normal menstrual cycle. And the IUD doesn't really change that, so it wouldn't really impact those symptoms.
So, and of course, when we talk about the pill, it sounds like we're also talking about one particular thing, but women need to also understand that there are many, many different birth control pills and different levels of the estrogen component, the progestin. There's a progestin-only pill. There's pills that change in the dosage over time. There's pills that give you the same hormone every day, et cetera. There's some pills that are better, perhaps, for reducing PMS or PMS-like symptoms. And that's one of the reasons we often put women on the pill. What I said is one of the worst things we ever did with the birth control pill was call it the birth control pill. We should have called it like the HRP, which, the female hormone regulating pill, because we prescribe it for many reasons other than contraception. And then there are bonus benefits, like in many women, it decreases acne. In some women, it decreases migraines. In some women, it increases migraines. So all kinds of various choices there. But the number one myth about the birth control pill, which I want to debunk right now, does the pill cause weight gain?
Oh, this is such a good question. This is another one of these things where clinical studies would say no. But I know that as a healthcare provider, I have seen women who absolutely, 100% believe that birth control pill caused their weight gain. And when they stop it, they are able to lose weight. And so from a scientific perspective, the evidence does not support the fact that the birth control pill for the majority of women will increase weight. But I just know that there are some women, individually that do have problems with weight gain from the birth control pill.
I think the studies will show 2 to 3 pounds can be attributed to increased, quote unquote, water weight, fluid retention, especially at certain points in your cycle. And a lot of women will see that in their breast size. But I think what people need to understand about the way we do these clinical trials and the way we come up with these conclusions is it's an average of all women, which means in some women, it may not affect them at all. And in other women, it may affect them somewhat. So what I usually say is this all depends on everything. However, most women who go on the pill for a certain length of time. So it could be a year, it could be 10 years. And if you were 20 when you went on the pill and you were 30 when you went off and you gained 15 pounds from the time you were 20 to 30, you can't blame that on the pill. So the weight gain we're talking about is women who go on the pill and in the first, 1 to 3 months gain 2 to 3 pounds, and that can be attributed to the pill. The rest is Haagen-Dazs and not exercising and,
and age, frankly, age can definitely,
and college.
Right.
And all of the things that we do. Yeah. I once looked at a study which showed that the average American woman gained 0.8 of a pound from Thanksgiving to New Year's Eve or Thanksgiving to New Year's Day, which doesn't sound terribly much until you add that up over 20 years of Thanksgivings.
Right.
And that can account for just about the typical weight gain of a woman who from the time she's 20 to the time she's 40. We very often talk about the freshman 15 in college, that women will gain 15 pounds and men, but we're focused on women, but it happens to men too. And part of that is maturing and your body changing. But part of that is no longer sitting down to a regularly structured dinner with your family where your mother is putting healthy food on the table, as opposed to going to a college environment where it's, all you can eat buffet 3 times a day.
Right.
Plus beer. plus alcohol, plus pizza,
plus the freedom to buy junk food whenever you want, right?
Well, and plus just all of that, bad behavior being around and the, change of cycle. But if you think about after college, 0.8 of a pound from Thanksgiving to New Year's every year for 20 to 30 years really adds up. So I call Thanksgiving a gateway holiday because it's kind of the beginning of the holidays. So what other myths do you want to debunk about diet and exercise?
Oh, well, I am not an expert in diet or exercise for that matter, to be honest. We don't, as doctors, we don't get a lot of education about that. But one thing I have learned that it's taken me a while is, and this is through personal experience, is it's very difficult to lose weight with just exercise. Mm-hmm. Because if you think about the amount of calories that you burn, even with very extensive exercise, even a really, hard workout, it's pretty much about the same as what you ate in breakfast, if not a little bit less. So, really to lose weight, you absolutely have to address, the diet component as well. And that's something that I've frankly learned through personal experience, even more than through my medical experience.
I haven't learned it yet, but my mantra has become, you can't out-train a bad diet. And one of the best things, lots of exercise physiologists criticize the calorie counts on the various aerobic machines like treadmills and elliptical machines and bicycles and those things. But I think those calorie counters are great for one purpose. And that is, I know for me, if I do 30 minutes on the elliptical machine at, breaking a serious sweat, I burn 300 calories. That's 1.5 cookies.
Right.
So there's nothing else that puts it into that much perspective. I think where exercise also really helps is that for some women, the hour that they're in the gym is the 1 hour that they're not eating. But it also is reinforcing healthy behaviors, and it's interacting with other like-minded people. But it's also showing you and reinforcing how much of an effort and how much of a caloric burn you have to burn off that 1.5 cookies. Anyway, there's so many myths we could debunk. As I said, I have a whole section of debunking the myths on my website at drdonica.com. Is there anything you want to leave people with as your, final message and tips as far as dealing with women's health myths and women's health questions?
I think, it's just like anything else. When you're looking for information, in an ideal world, it'd be great if you had access to your healthcare provider 24/7 and could spend as much time as you want, in the office. But we know that healthcare providers' time is limited. So the important thing is to find accurate resources for information. We are all very attuned to this whole quote unquote fake news thing as it relates to politics. But I think it's really important for your health, because there are a lot of websites out there, even by very prominent people, that promote a lot of things that have no evidence behind them, that aren't particularly accurate, and can really lead you down a bad path. And so I think when you find a healthcare provider that has a website like you, like me, that curates a list of really reputable references where you can go to get that information in the middle of the night when you can't talk to your healthcare provider, or at least to provide yourself with a basis of knowledge before you go to talk to the healthcare provider. Really seek out those reputable sources, because then
even reputable sources, even my website, for example, it may not apply to you.
Exactly.
So what I'm talking about may not be what you have.
Exactly.
Or it may not, just because you have a certain set of symptoms, for example, that could add up to many different diagnoses. So one thing I always say is, if you have questions, certainly use the internet and your reputable sources for background information. And everything we talk about, obviously, is for background information.
Yes.
But if you have personal questions about your own personal symptoms or diagnoses, don't feel like you need to sit at home and make your own diagnosis. This is right. Even though your healthcare provider's time is limited, this is still not the era of do-it-yourself medicine. So what I advise is making a list of your questions on your phone. The same way you have a grocery list, make your questions for your doctor list. But the most important thing you can make is the appointment.
Absolutely. And another great thing on your phone is like period tracker apps. So you're always going to be asked your last menstrual period, no matter what. It's one of your vital signs. So keeping track of that, and you can do that on your phone with some really great apps too.
That's great. And so where can people find your website?
So it's drladydoctor.com. So it's DR and then spelled out ladydoctor.com. And you can also find me on Instagram and Facebook as well at Dr. Lady Doctor.
Awesome. And please, I'm going to invite everybody to send me any questions they have in follow-up to this segment. We have a separate email address at askdrdonica@gmail.com, and I will send you any of the provocative questions that we get. And we always get really interesting ones. So thank you so much for joining us. This has been so much fun. And I hope we can have you back sometime in the future.
I would love to. Thank you so much. It was a
Take
pleasure.
care. Bye.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.